So abnormal psychology is an interesting field because in many ways it's the extension of abnormal psychology is clinical psychology. So abnormal tends to be kind of more on the academic or um, research end of things. Abnormal psychology is a branch of psychology that studies unusual patterns of behavior, emotions, and thoughts, which may or may not be understood as precipitating a mental disorder, which is what's treated with clinical psychology. Although many behaviors could be considered as abnormal, this branch of psychology typically deals with behaviors in clinical context. There's a long history of attempts to understand and control behavior deemed to be aberrant or deviant, and some of the models include a statistical model, a social standards model, a moral model, um, even one that goes back to the turn of antiquity, the spiritual model. And there's often a cultural variation in the approach that's taken. So the field of abnormal psychology identifies multiple causes for different conditions. They employ diverse theories from the general field of psychology and elsewhere, and much still hinges on what exactly is meant by abnormal. For example, over time, uh, before the 1960s, being being a homosexual was actually considered abnormal, but with the advent of DSM-3, that changed. In fact, if you go back far enough, being a homosexual back during the American Civil War was considered a felony. There's traditionally been a divide between psychological and biological explanations and reflecting a philosophical kind of dualism in regard to the mind-body problem. Remember that went all the way back to Rene Descartes during the Renaissance. There have also been different approaches in trying to classify mental disorders. So scientists, remember I told you these were research and theory based, are trying to put these into groups, not necessarily like a clinical psychologist would do, but as academic. The science of abnormal behavior studies two types of behavior, adaptive and maladaptive. Behaviors that are maladaptive suggest that some problems exist and can also imply that individual is vulnerable and cannot cope with environmental stresses, which is leading them to have problems functioning in daily life, in their emotions, the way they think, their physical actions, and the way they talk. Behaviors are adaptive are ones that are well suited to the nature of people, their lifestyles, their surroundings, and to people that they communicate with, allowing them to understand each other. So when you think about what the definition of abnormal is, you might ask yourself, is what they're doing adaptive or is it maladaptive? Clinical psychology is the applied field of psychology that seeks to assess, understand, and treat psychological conditions in clinical practice. Theoretical field known as abnormal psychology may form a backdrop for such work, but clinical psychologists in the current field are likely to use the term abnormal in reference to their practice. Psychopathology is a similar term to abnormal psychology. When I was in graduate school, that's what it was called, but has more of an implication of underlying pathology or disease process, and as such is a term more commonly used in the medical specialty of psychiatry. So psychiatrists practice, they do the same kinds of things, except they don't really do a lot of talk therapy. They look for disease processes and generally treat them with medicines and inpatient hospitalizations. So I mentioned that there was a need to try to understand what causes maladaptive behaviors. One of the things that has happened in the field of abnormal psychology is a long history of, at least in the United States, of trying to come up with a typology for it. And what I included on the next slide is the history of the Diagnostic and Statistical Manual. So this is a brief one. It doesn't take that long to read or watch. And so if you have questions, it started off as I said earlier, in the 1940s with World War II, and it's been refined. DSM 1 to 2 to 3. We're at DSM 5 right now, and hopefully the system's getting better and more useful.